Well, Tennessee healthcare providers can now refuse to perform or pay for a procedure if it goes against their conscience. Welcome back to News 2 at 4. I'm Corey Johnson. News 2 State Capitol reporter Tori Gessner joins us to explain how it works.
Corey, this legislation called the Medical Ethics Defense Act applies to doctors, nurses, even pharmacists, giving them the power to deny a patient care if it goes against their ethical, moral, or religious beliefs. Governor Bill Lee just signed the measure into law. Dr. Jonathan Shaw, an OBGYN, crossed state lines to follow his conscience, nearly pushed out of his previous practice in the Northeast after he says they tried to push him to announce his pronouns to his patients, a policy against his personal beliefs.
I use the term conscientious objection to describe my position on the practice of being forced to announce my own pronouns, but this was seen as a barrier to patient care. The ability to do my job was called into question, and human resources were consulted.
Dr. Shaw was drawn to Tennessee because he says the state lets doctors use their conscience when providing care. Now, that freedom is officially law. Under the Medical Ethics Defense Act, just signed by Governor Bill Lee, healthcare professionals like doctors, nurses, and pharmacists can refuse to perform or pay for procedures or prescriptions that go against their conscience. The sponsor, also a physician, says it'll protect practitioners from moral injury.
Patients need to know that our doctors are advocating for them with a clear conscience.
But some doctors believe their patients should be the priority.
Politicians need to stop dictating medical care, and this bill allows politicians to take their intrusive efforts even further to dictate medical conscience. In my opinion, and the way I like to try to practice medicine, is to honor the patient first. That's where my conscience lies.
Healthcare providers cannot deny care in emergency situations, but some lawmakers worry a doctor could still use their beliefs to dictate the type of care they provide.
We're not talking about an elective abortion. That's not what we take that off the table. We're talking about a lady comes in and this pregnancy puts her life in immediate danger.
There are doctors who practice medicine consistent with a pro-life worldview in which an abortion is never medically necessary, and there are procedures that are available in order to treat a woman in that kind of circumstance without having to perform an elective abortion.
The Medical Ethics Defense Act went into effect immediately with the governor's signature. There are 8 other states with similar laws on the books. The Alliance Defending Freedom, the out-of-state interest group that backed this bill, says it's never been challenged in court.